You're listening to the Prof. Joe COVID-19 Aged Care Podcast. If you're an aged care professional, you can connect with us at the Prof. Joe COVID-19 Aged Care Facebook group. Otherwise, you can connect with us at our regular page at Prof. Joe Online. You can also visit our website at profjoe.com.au for a collection of all our links. Also, feel free to email us at info@profjoe.com.au. Welcome.
Situation briefing. COVID-19 is here. In 3 months, COVID-19 has gone from one small province in one country on one continent to 167 countries. In the last week of March, there were already 382,000 cases and 16,000 known deaths around the world. It's unlike anything we've ever seen before. Some people say, hey, there are about 1 billion cases of flu predicted worldwide each year, and this pales in comparison. We want to make this point clear. It's not just the flu. And we have to stop thinking it's like the flu. It's more contagious. And once it's caught, it sends massive numbers of people to hospital. It puts an extraordinary number of people on ventilators. And it creates critical levels of stress on ICU departments worldwide. Some are simply unable to cope with the numbers, meaning doctors are being forced to make incredibly difficult decisions about who lives and who dies every day. Given the chance to spread widely, this virus is going to harm more people than the flu in all of those categories. The virus is simply still young. Aged care is particularly vulnerable. Let's be crystal clear about this. Large numbers of residents will die if the virus becomes widespread and finds its way into the care homes. But let's also be clear about this. If we act now, and we must act now, maybe we can stop it or at least save thousands of lives. There's going to be a lot of challenges. The most important intervention is going to be to isolate people in aged care. So we need to change the way we think about locking down facilities. We've never had to be so vigilant about locking down as we are right now, because if this virus gets in, the battle is going to be exponentially harder. And we will need to fight this battle right to the end, right alongside our residents, because every single life is still going to matter. As we're going to talk about, we're going to need to find a paradigm shift. We're going to need to think of an aged care facility more like an intensive care unit when it comes to ensuring that every infection control measure that is required is put in place and stays in force. In this podcast, we're going to discuss 9 critical actions to help save lives. We're going to explore those actions with a focus on the practicalities of putting those actions into place right now.